And the last recommendation underneath foster care is reporting to collect social workers' caseload data. Is there a motion to approve the recommendation on page 31?
So moved.
Second.
It's moved in second. Roll call.
Weber.
Aye.
Chesbro.
Aye.
Dickinson. Grove. Mansour. Has 3.
Thank you. Okay, that covers all of our items under social services. Thank you so very much. We're now at health. Underneath the category of health, we'll begin. This is also a voting-only agenda. And we will begin with the Emergency Medical Services Authority. This is issue number 1, statewide emergency medical response capacity assessment. Is there a motion to recommend the language here requesting supplemental reporting language for EMS? It's listed on page number 2, the staff recommendation underneath item number 1. Is there a motion to approve that recommendation?
Second.
It's been moved and second. Roll call.
Weber.
Aye.
Chesbro.
Aye.
Dickinson.
Aye.
Grove. Mansour. Has 3.
Okay. Item number 2 is the mobile field hospitals. This is to appropriate 1.96 million general funds to EMS to properly store, equip, and make operations for their mobile field hospitals. Is there a motion for that item?
So moved.
So it's moved. Is there a second?
Second.
A second. Okay. Roll call.
Weber.
Aye.
Chesbro.
Aye.
Dickinson. Grove. Mansour. Has 5.
Okay. We're now at item 4140, which is the Office of Statewide Health Planning and Development. We have some Song Brown recommendations. There's a recommendation, and I'm not sure if everyone got the adjustment or the change in the recommendation. Oh, I'm sorry. The first one doesn't have a change. Issue number 1 under Sun Brown is the same. Approval of the proposed BCP for $2.84 million and it lists there in terms of the language and the placeholder language as to what it's for. It's on page number 3 of the health issues that we're dealing with the health. So as a result, it's on page 3 of that particular agenda. Is there a motion to approve the Song Brown first recommendation?
Second.
It's been moved in second. Roll call.
Weber.
Aye.
Chesbro.
Aye.
Dickinson.
Aye.
Grove. Mansour. Has 5.
Okay. The second one is the advocate's proposal, and this is the one that has change. Has everyone seen the change? Okay, fine. That basically makes it that makes a recommendation for the funding as well as the fact that the priority goes to California residents. Is there a motion to approve it as presented? Yes.
So moved.
It's moved. Second.
Second.
Okay. Roll call.
Weber.
Aye.
Chesbro.
Aye.
Dickinson.
Aye.
Grove. Mansour. Has 5.
Thank you. Now we're at the item dealing with the Department of Managed Health Care. There are 4 items under the Department of Managed Health Care. The individual market reform, BCP. Is there a motion to approve the recommendation under the individual market reform?
Second.
Moved in second. Roll call.
Weber.
Aye.
Chesbro.
Aye.
Dickinson.
Aye.
Grove. Mansour. Has 3.
Okay. Next one is the Medi-Cal expansion BCP. To approve the BCP as budgeted for 18 positions, and it lists the amount there on page number 5 under issue number 2. Is there a motion?
So moved.
Second.
Okay, it's moved in second. Roll call.
Weber.
Aye.
Chesbro.
Aye.
Dickinson.
Aye.
Grove. Mansour. Has 3.
Okay. Issue number 3, which is the federal mental health parity proposal. And this is approve of BCP as budget and placeholder language to implement the federal mental health parity. Now, do we have the addition? This is the current language and not the language that is with that we saw this morning. Is this the current language?
This is just the administration's proposal.
This is the administration's proposal and not Mr. Bell's proposal.
I do have a question and a comment about that.
Okay.
Do we know whether what we would be doing here matches what the Senate's doing? Would it be in conference? It doesn't.
I don't think per their agenda for full budget committee today, no.
Okay, well, I'm hopeful. I just want to say I'm hopeful that it'll be discussed further in conference because I think there's some merit to what Mr. Bell's brought to us, but it's also a Senate proposal, so from one of their members. But I am hopeful that further discussion to try to determine what the level of funding needs to be in order to get this moving as quickly as possible to get parity at the earliest opportunity.
Just to follow up, if I may, Madam Chair, the Senate Budget Committee today was taking up Mr. Bell's,
They were taking up his proposal today that he shared with me.
That's-
I do not know the results of that.
but that's what,
The Senate had passed this, and they were taking up, the full Senate was taking up this proposal.
full Budget Committee. So
Yeah, full Budget Committee.
I would just echo Mr. Chesbro's
Okay,
sentiments on this one.
Right, me too, it's same thing, okay. All right, this is, yeah, I saw this, I'm not sure if it was approved. Somebody sent me this, you did, okay, right. But I'm not sure if it was approved. This is, we had the governor's proposal and then their proposal. So is we're at the health parity, which is issue number 3.
Number 3.
Underneath 4150, Department of Managed Health Care, issue number 3. Is there a motion? Did we have a motion for that?
I'll move it on the hope and assumption that we will be moving it to, thereby moving it to conference committee for further consideration.
Okay.
Seconded in the same spirit.
Second in the same spirit. Okay. Is there, let's have roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson, Grove,
I'm good. Okay.
Mansour has 3.
Thank you. This is the Office of Patient Advocacy Resource Transfer. Is there a motion to approve the recommendation?
Second.
Been moved in second. Roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson, Grove, Mansour has 3.
Okay, we're now into the Department of Health Care Services. This is the we begin with issue number 1, ACA's Pregnancy Services. Is there a motion to adopt the recommendation?
So moved.
Okay, moved in second. Roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson, Grove, Mansour has 3.
Okay. Issue number 2 is the pediatric dental outreach. This is the proposal to approve. There's 2 items to approve. The proposal is budgeted to implement a pediatric dental outreach, as well as to adopt trade bill language to establish a metric to monitor utilization and access in the dental care program. Is there a motion?
So,
It's
second.
been moved in second. Roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson, Grove, Mansour has
Okay.
4.
Thank you. This is, the third item is issue number 3 is a pediatric vision outreach, and this recommendation is to deny the proposal and the trailer bill language in light of the complexity and lateness of the proposal. Is there a motion to approve that?
So moved.
It's been moved in second. Roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson, Grove, Mansour has 3.
Okay. This brings us to item number 4, issue number 4, which is the Medi-Cal expansion, county savings, the BCP, and the May revised updates. Is there a motion to approve the item that's listed on page number 10, the recommendation of the staff?
I'll move it. Only a small I told you so on this one.
Okay.
Second.
He moves, I told you so. Okay. Is there a second to that?
I second it.
Second, I told
I'm
you
not
so?
seconding the I told you so.
Okay,
I'm
just
moving-
second
seconding
the
the item.
motion. All right, sounds good. All right, we have a motion. Roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson, Grove, Mansour has 3.
Okay. Issue number 5 is ACA implementation. The recommendation, the approval of the BCP is budgeted with 8 positions and $1.1 million and $1 million in 2015. The language is found on page 11. Is there a motion for the approval of the recommendation under issue number 5? Yes, so moved. It's been moved and it's been second. Roll call.
Weber,
Aye.
Chesbro, Dickinson, Grove, Mansour has 3.
Okay. Issue number 6 is the investment in mental health wellness implementation. The subcommittee is there's a recommendation approval of a modified version of the BCP by reducing the request by one position. Is there a motion to approve the recommendation? Yes. It's been moved in second. Roll call.
Weber.
Aye.
Chesbro. Dickinson. Grove. Mansour. Has
Okay.
4.
Passed 4. Issue number 7 is ACA Medi-Cal eligibility integration and CalHERS MCED, the BCP and the trade bill language. This is recommendation number 7, and the recommendation is actually found on page number 13 at the top. Is there a motion to approve the item? It's been moved in second. Roll call.
Weber.
Aye.
Chesbro. Dickinson. Grove. Mansour. Has 3.
Okay. Issue number 8 is the residential and outpatient programs, and this is to approve the BCP as budgeted, and the recommendation is listed on page 13 with the numbers and the years. Is there a motion to approve issue number 8's recommendation? It's been moved in second. Roll call.
Weber.
Aye.
Chesbro. Dickinson. Grove. Mansour. Has 5.
Okay. We're now at issue number 9, a recommendation concerning the state outpatient contract drug list. The recommendation is denied the proposal and the trailer bill language. Is there a motion? It's been moved in second to deny the proposal. Roll call.
Weber.
Aye.
Chesbro. Dickinson. Grove. Mansour. Has 5.
Thank you. That brings us to issue number 10, which is the Medi-Cal enrollment fingerprinting and criminal background checks for program. It's approval of the trailer bill language to give authority to DCH to receive the results of criminal background checks. Items listed, the recommendations listed on page 14 for issue number 10. Is there a motion? It's been moved and second. Roll call.
Weber.
Aye.
Chesbro. Dickinson. Grove. Mansour. Has 3.
Okay. That brings us to issue number 11, the Coordinated Care Initiative update, savings and trailer bill language, the approval of the update of CCI's saving estimate and adopt the trailer bill language, placeholder trailer bill language to address the role of Medicare Advantage programs. Is there a motion? It's been moved in second. Roll call.
Weber.
Aye.
Chesbro. Dickinson. Grove. Mansour. Has 3.
Okay, fine. This brings us to item number 12. There are 4 recommendations underneath the Major Risk Medical Insurance Program elimination. Did you want to take them all together, or do you need to break them out? You're fine? Okay, good. Could I have a motion concerning the Major Risk Medical Insurance Program elimination? The recommendations are found on page 16, and there are 5 recommendations. Is there a motion for the 5? It's been moved in second. Roll call.
Weber.
Aye.
Chesbro. Dickinson. Grove. Mansour. Has 5.
Thank you. That brings us to Medi-Cal estimates, issue number 13.
This one they'd like to split.
And did you want to break this one out?
Yes.
Okay, we need to break this one out. There are how many items?
Issues 101 and 102. 2 issues.
Okay, it's 2 issues. Oh, 1, to approve the Medi-Cal estimate issues 101 and 102 with any changes to conform as appropriate to other actions that have been or will be taken, and to approve the proposed budget language related to KDA settlement. Do you want to break out 101 and 102, or you want to break out those 2 issues?
I'm going to break out 101 and 102.
Okay, so we're going to approve, first of all, the estimate issues of 101. Okay, is there a motion for that?
Second.
It's moved in second. Okay, roll call.
Weber.
Aye.
Chesbro. Dickinson. Grove.
No.
Mansour.
Okay.
Has 3.
Okay, now I need a motion to approve the Medi-Cal estimates for issues 102. Is there a motion? Moved. Is there a second? Thank you. Okay. Roll call.
Weber.
Aye.
Chesbro. Dickinson. Grove. Mansour. Has 5.
Okay, and then a motion to approve the proposed budget language related to the KDA settlement.
I think that was part of the last motion.
Okay, moved in second. Roll call.
Weber.
Aye.
Chesbro. Dickinson. Grove. Mansour. Has 5.
Okay, fine, that takes care of issue number 13. We're now at issue number 14, which is a recommendation concerning the county COLA 1-year suspension. Adopt the trailer bill language to suspend the county COLA for the budget year only. Is there a motion? It's moved. Second, roll call.
Weber.
Aye.
Chesbro. Dickinson.
Aye.
Grove. Mansour. Has
Madam
4.
Chair, I just wanted to say
Yeah.
I have historically opposed this kind of recommendation, but I understand the counties are not opposed this year,
Right.
so that's why I have supported it.
Okay, sounds good. Okay, this takes us to issue number 15, which is the Martin Luther King Jr. Community Hospital. And the recommendation is listed here with regards to what it does and what it ensures. It's on page 18, issue number 15. Is there a motion? It's moved in second. Roll call.
Weber.
Aye.
Chesbro. Dickinson. Grove. Mansour.
And I'm sorry, I mixed up. Are we on issue 15?
Yes, we are, which is the Martin Luther King Hospital.
Yeah, I am now. Yes.
Mansour.
Yeah, off on that one.
That has 4.
Okay, fine. Item 16 is Caregiver Resource Center augmentation. This is a motion to approve 2.9 million general funds to DHCS for the Caregivers Resource Centers. Is there a motion to approve the recommendation? It's been moved in second. Roll call.
Weber.
Aye.
Chesbro. Dickinson. Grove. Mansour. Has 5.
Okay. We're now at issue number 17, which is the Medi-Cal trailer bill language to repeal the provisions of AB 97 and make necessary adjustments to the Budget Act to reflect the following changes. Now, there are 2 items, each with one with 2 in it. Are we taking them all together for that recommendation?
And it's the change.
Okay, if there's a change in it. This is no longer the effective language. You all should have a copy of the proposed change. Okay? Do you want to take it all at once or divide it up? All together? Can I have a motion to approve the staff recommendation concerning Medi-Cal provider rates?
I will move it, but I also want to make a comment.
Okay, make your comment.
First. Well, first of all, there's been some tension about around the date, question of when we should implement this, and either January or April. And I just want to say that there are some Medi-Cal providers in underserved communities around the state that are hanging by a thread. And so months and days do matter whether they're going to be there to serve our expanded Medi-Cal population when we finally get back to restore the reduction. So I'm hopeful that we can get it sooner rather than later, but this language, it's compromise language so we can continue to work on that question, and I appreciate the fact that we've gotten to that compromise. Secondly, I want to make sure that this proposal is intended to help all Medi-Cal providers, including the retroactive recoupment of the AB 97 clawback, and specifically the examples I have are 2 tiny little rural hospitals in my district that have distinct part nursing facilities, and just sort of checking to make sure that this rescue is on the way to those kinds of facilities. So,
Eliminates all the retroactives. Okay?
okay.
All right.
Thank you.
And you made a motion? Is there a second?
I will second it only with the comment that this goes a little further than I would have gone.
Okay. Well, let's hope, okay, sounds, good thing we didn't go less than you would have gone. Okay, that's helpful to know. Is there a motion? We had moved and we got a second. All right, roll call.
Weber.
Aye.
Chesbro.
Aye.
Dickinson. Grove. Mansour. Has 5.
Great, okay. That now brings us to the Department of Public Health, 4265. We have 9 issues on the Department of Public Health, beginning with issue 1, which is drinking water program transfer. Is there a motion to approve the recommendation listed on page 20? Is there a motion?
So moved.
It's been moved and second that we adopt the recommendation on page 20 for issue number 1. Roll call.
Weber.
Aye.
Chesbro.
Aye.
Dickinson. Grove. Mansour. Has 5.
We're now at issue number 2, which has to do with licensing and certification program estimate. This is approval of the licensing certificate program estimate as budgeted. Is there a motion to approve issue number 2?
So moved.
Second.
Moved in second. Roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson,
Aye.
Grove, Mansour, has 4.
Okay. This is issue number 3, licensing and certification evaluation of BCP and trailer bill language. The staff recommendation is to approve, and there are a number of, there are 2 main aspects of it. Do we need to separate them out, or are you fine with the both? Okay, sounds good. Can I get a motion to accept issue number 3, staff recommendation?
So moved.
It's been moved in second. Roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson, Grove, Mansour, has 3.
Okay. This issue number 3 is genetic disease screening program estimate. Approve the genetic screening program estimate as budgeted. Is there a motion for issue number 4?
So moved.
It's moved in second. Roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson, Grove, Mansour, has 3.
Thank you. That brings us to issue number 5, which is a Proposition 99 and medical marijuana program reductions. This is a motion to approve the reductions as budgeted. Is there a motion?
So moved.
It's moved in second. Roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson, Grove,
She's off. Okay.
Mansour, has 3.
Okay, issue number 6 is biomonitoring program funding. There's a recommendation on page 23. Is there a motion to approve the recommendation for the biomonitoring program funding?
So moved. Second.
Okay, it's moved in second. Roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson, Grove, Mansour, has 3.
Okay. This brings us to issue number 7, which is the Ryan White data matched trailer bill language. It's approval that of the trailer bill that's its approval of a recommendation on page 23 for issue number 7. Is there a motion?
So moved.
Moved. Second. Roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson, Grove, Mansour, has 5.
We're now to issue number 8, which is SNAP ED contract conversion BCP. Is there a motion to approve the recommendation that's listed on page 24 and the trailer bill language affiliated with it? Is there a motion for
So moved.
issue number 8? It's moved in second. Roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson, Grove, Mansour, has 3.
Thank you. That brings us now to the final item underneath the Department of Public Health, which is the public health reinvestment. Is there a motion to approve the recommendations for the public health reinvestments that are listed on page 25, amounting to, I think, $55 million?
Madam Chair, I'll move, and I just, they're all important. I especially wanted to note the Black Infant Health and the Emmy restorations, and with thanks.
Thank you. Okay.
Second.
All right. Is there we've had a first and second, so roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson, Grove,
I wish we could separate these sub-issues out. So,
You want to break them out?
I mean, I would support Black Infant Health, adolescent family life, those things, but I'm not going to support abortion issues with teen pregnancy, so maybe you should, but it's okay, I'll just stay off the bill.
Well, we'll know that you're excited about Black infant health and something else you said. Okay, so we'll put that in the record.
Mansour, okay, has
All right.
3.
Thank you very much. All right. We're now to items 4440, which is the Department of State Hospitals. Issue number 1 has to do with Salinas and Vacaville bed capacity increase. This item is listed on page 26 with the staff recommendation. Is there a motion for the staff recommendation?
So moved.
It's moved in second. Okay, roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson, Grove, Mansour, has 5.
Okay, we're now at issue number 2, which is Patient Management Unit BCP and Trailer Bill. Is there a motion to approve the recommendation, issue number 2?
So moved.
Second.
It's moved in second. Roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson,
Aye.
Grove, Mansour, has 5.
Okay. We're now at issue number 3, which is Patient Management Unit, BCP, and trailer bill language for issue number 3, which was the state, which is the patient management, yes, units.
Sorry, there's a mix-up on here.
There's a mix-up somewhere. We did patient management already, so now we're at statewide enhancement. I'm sorry, units. They don't match our agenda. Statewide enhancement treatment units. Is there a motion?
That's my motion.
Is your motion? Second. Roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson, Grove, Mansour,
Well, it's a little confusing in our agenda. They don't match the sheet. So we've done statewide enhancement treatment units. We're now doing,
no, we're doing that.
we're doing statewide now. Yes, so we did patient management earlier. They're switched on us. They mixed up, yeah, they got mixed, yeah, in the printing. Okay,
Has 5.
okay. Now we're at the issue of restoration of competency program expansion, which is issue number 4. Is there a motion to approve the expanded, okay?
Second.
So it moved in second, roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson, Grove, Mansour, has 5.
The last item on the state hospital has to do with retention and recruitment of state hospitals. Retention bonuses, this has to do with our physicians and psychiatrists. Is there a motion?
So moved.
It's moved, is there a second?
Second.
Okay, moved in second, roll call.
Weber,
Aye.
Chesbro,
Aye.
Dickinson, Grove, Mansour, has 3.
Okay, that takes care of that. We're now at our final agenda item, which has to do with child care and early education. There are 2 main items, 2 vote-only items here. And these are items, obviously, that overlap with our Ed department. The first one has to do with the Assembly, the early education plan. And there's a staff recommendation to conform to the Subcommittee 2 action to adopt the Assembly early education proposal. Is there a motion?
So moved.
It's been moved and second that we would conform to Sub 2's action to adopt the Assembly early education proposal. Roll call.
Weber,
Aye.
Chesbro.
Aye.
Dickinson. Grove. Mansour. Has
Okay.
3.
And the other issue that deals with a May revision for case management information and payrolling system. Is there a motion to approve the May revision request as budgeted? It's
Second.
been moved and second. Roll call.
Weber,
Aye.
Chesbro.
Aye.
Dickinson. Grove. Mansour. Has 5.
Believe it or not, we will keep the roll open. I think Mr. Mansour has some votes he wants to record. But I want to thank all of you for,
Closing comments.
Madam Chair,
we have some closing comments.
recognize me before him.
Yeah, recognize you before him?
Yeah.
No.
There's a reason.
Age
I know
before
what
beauty.
he wants to say. I'm going to say it before both of you say
Okay.
it. I want to thank Mr. Chesbro for his service to this committee and the various communities that he's been a strong advocate for. As a new person coming on the committee, the one thing I was told was to be sure to hang close to Chesbro because he has the institutional knowledge. And I discovered that he not only has the institutional knowledge, but he has the passion and compassion for this area. And I really want to thank you for your support of me and your helping me through this first year. You've been a rock. I also want to thank Mr. Dickinson, who's also been a good rock. He has given us a level head in terms of county issues and things of that nature. So I really appreciate the both of you for allowing me to chair this committee, knowing that most of you had probably far more experience than I had and could have done probably a much better job. But I really want to thank you for your support. I want to thank my colleagues over here as well, who've done a yeoman job. I thought I was going to meet the dragons, but I didn't. And but I think we all have equal passion about families and children and those in need, and sometimes it's expressed differently, but I really want to thank you for being a very cooperative and supportive committee members and really keeping us and helping us to move forward. And I can't say enough about our good staff that's been here, not only in our individual offices that are back there, and others who have really carried the water for us in terms of really keeping us focused and responding to the issues that we all had to respond, not only those that sit up here, but those who are behind all of us. So I'm really appreciative to all of you for making my first experience in Health and Human Services. I had no idea what I was getting into, and I've said over and over, this was one of those let Mikey do it things, because I didn't know enough to say no. But nonetheless, it has been a great experience, and I simply want to thank all of you because it's been a really difficult and yet hard work. But I think given the things that we've been through in California, it's been a great experience to be able to be a part of the rebuilding process. So I want to thank you, but I just want to salute Mr. Chesborough because I know that's what you was going to do, and I just want to do that.
For the record, Madam Chair, I just make one correction to your statement with all due respect. There's nobody that can run a committee in this house like you ran a committee. So even
Amen.
with their experience,
Amen. No, I agree.
I'm like, okay.
Anybody who served on the subcommittees with me knows my hearings, many people in the room remember, lasted long hours.
I'm just
And
trying to pay you a good compliment that you could have ran the committee better because I have to disagree.
no, I
with that.
agree.
Thank you. Thank
I
you.
agree. This has been a very well-run, tight committee. So.
Well, Madam Chair, if I may, before Mr. Chesbrough gets the last word, thank you for your leadership in chairing the committee. This is a tough, no matter how steeped you are in this, it's a tough assignment, and you have handled it with great equity and aplomb for this first year. And so kudos to you and all of the staff. But I did want to say a word about Mr. Chesbrough because he and I have known each other for more years than
Many decades.
we probably would choose to count. He has the background of county government, which I think assisted him when he came to the legislature, and he's always been, as you said, passionate about the issues of health and human services, but also always willing to listen and to engage all the interested parties in what their views and perspectives might be on these issues, because there are a host of those. But what I will always remember as Mr. Chesbrough moves on to his next challenges beyond this committee and the legislature is what a difference he's made for so many Californians who depend on the health and human services that are offered through the state of California. That will be a long-lasting legacy, and I want to thank him for his service in that capacity as a member, but also as a friend.
Well, thank you. It really touches me very deeply to have my colleagues' respect. So thanks. I, altogether, counting being on sub 3 over in the Senate for my entire 8 years, and then being on this for 6 years, I've been doing this for 14. This is my 14th year as a member of Health and Human Services Budget Subcommittee, and I want to say to you, Madam Chair, that I became Budget Sub Chair my first year, so I know the feeling of being thrown out there and set in the water and told to swim, amongst all the piranhas and the sharks. So it's been a great challenge, but you have done it very, very well, and I really respect you for it. And also, I'm very fond of our staff and very thankful that we have such committed, hardworking people who are able to help us do what we do. There's several things that make me optimistic about and make it not a bad time to leave the legislature. One of them is, of course, there's more money. And after years of having to suppress and hold back things that I care deeply about, and I think at least on some of them we all care deeply about, there's a time where we can modestly begin to creep forward and try to come back the way we hope the California economy will continue to do. Another one is the 12-year terms, and I'm not prejudging what you're going to do, but going forward in terms of leadership, but I do think there's a real value in legislators finding a place and really becoming the go-to expert, because with all due respect to staff and the professional people who represent themselves before us, represent the various things, and the people who work on this stuff for many, many, many years, the Assembly particularly has been at a real disadvantage because members come in and it takes a while to really begin to understand the process. So my hope and wish is that you, I'm putting you on the spot here, but you will stick with this, because I think there's real value to having members who are not only on a par with staff in the third house, but actually the go-to knowledgeable person who the third house and the staff goes to. So And I think you really have the capacity to be that kind of a leader, whether it's here or in another area. But and the other thing I want to say makes me optimistic is it's been very subtle, but there's been a shift in the last year or two, I think, in terms of bipartisanship, the ability to say, okay, we're going to disagree and fight about this over here, but when there's something that we agree on, we're going to work together. And so, and I think that's been reflected on a number of issues before this committee. So that makes me optimistic going forward as well. And I want to encourage and hope that that continues. But it has been a real privilege. I do take pride. Some of that pride is, you know, given the 2 recessions I've had to live through, and we've all had to live through during the time I've been here. You know, sometimes it's just making things less bad that you have to feel a sense of accomplishment from. Right. But that is meaningful. Mm-hmm. You know, if we're in a crisis and there's not enough money, trying to figure out how to help people get through it. And the other frustrating thing is that it always feels like we're at 10,000 feet. I think it's really important to get out and be with people, meet with people, see the faces on the numbers so that we realize that it's not just a whole bunch of numbers that we're racing through, but it's real people's lives that we're affecting, you know. Right. So anyway, again, thank you for your kind comments, and this has been a privilege, and it's with real mixed emotions that I say this is the last time.
So we'll call you, you know that.
I'm available.
We'll make you a consultant. You'll become staff. All right, thank you so very much. I hope everyone has a wonderful weekend. And thank you all for hanging in to the end. And some of you have been at every hearing, so I really appreciate that. So thank you so very much. And we're adjourned.